This year, an estimated 70,000 Canadians will have hip or knee replacement surgery to regain their lives of movement. Research shows, and most healthcare professionals would agree, that the more you know about your surgery and your role in your return to mobility, the better your results will be. In hip and knee replacements especially, the patient plays a critical role in the preparation for and recovery from orthopedic surgery. This three-part video series is designed to help you learn about your journey through the orthopedic care path and how you can be an active participant in your regained mobility.
I had an injury when I was 12, and my knee gave me problems from that time forward. When I was in my middle 30s, I was diagnosed with osteoarthritis. My family doctor referred me to an orthopedic surgeon because it was bone-on-bone pain. I couldn't walk across the room. I was very uncomfortable, so I was referred to an orthopedic surgeon.
Orthopedic surgeons see patients at the request of their family physicians, and the family physician will make the referral to the orthopedic surgeon if he or she thinks the patient will benefit from a joint replacement procedure. The hip replacement is a surgical procedure in which a metal ball and a plastic socket are used to replace the patient's natural occurring hip joint. It's a relatively straightforward procedure with several thousand being done every year in this country. It takes about 90 minutes and is done under a general or a spinal anesthetic. A knee replacement is a surgical procedure in which the covering of the knee joint is replaced by a metal and plastic device which permits the knee to continue to move but without pain. It's usually done under a general or a spinal anesthetic and takes approximately 90 minutes. The waiting times for this, unfortunately, are long, sometimes 6 months or longer to see the orthopedic surgeon. Surgeons feel badly about this because we realize these patients are having a lot of disability. We know that we can help them by doing an operation for them, and we wish we could see them sooner. I think it's useful for patients to bring someone with them, a family member or a friend, who can help them. They can help them interpret what the surgeon says. They can assist the patient in terms of explaining their degree of disability. Patients are often reluctant to say that they're having trouble, but a family member or a friend, much more forthcoming. The consultation will consist initially of the orthopedic surgeon taking a history, doing an examination, and then reviewing the patient's x-rays. And in discussion with the patient, a decision will be made about whether or not the patient is appropriate to consider joint replacement surgery. Patients are obviously concerned about the prospect of surgery, and a good part of the initial visit with the orthopedic surgeon will be spent reassuring them about the quality of the surgery, its safety, and the benefit to the patient.
The surgeon that I had had a very good reputation, so I was very confident when I was referred to this doctor. And as time went on, though, I became more and more anxious.
A surgical consent is a formal document signed by the patient which allows the surgeon to carry out the procedure that's been mutually agreed to by the patient and the surgeon. The consent should only be signed by the patient if they're comfortable with the procedure and with their understanding of the process around the operation.
In the area where I live, there is an education seminar that people attend. And with that, having that information talks about what you do before the surgery. Should you continue to exercise, keep yourself in good condition, or should you sit back and just wait for it to happen? They tell you about what the joint looks like, what's going to actually happen to you, and then they talk about recovery as well. So it's a long process. I was concerned about the scar. Is it going to be big? What is it going to look like? Is it going to heal properly? If I bend my knee, is it going to burst? You know, what actually would happen with my knee joint? So I asked those kinds of questions. I was concerned about pain too. Would I be able to manage the pain properly? Would I be able to ask for extra medication if I did in fact need it?
Patients have to be actively engaged in the process of getting better. And the best way to do this is for them to be well informed. They should be prepared to ask the surgeon questions about the procedure itself, what's going to happen to them after the operation, and what the anticipated outcomes will be from the surgery. I think all surgeons would agree that a well-informed patient is the best patient. Nobody likes surprises, and I think patients should be actively engaged in the process from the very beginning. It's important that patients understand what's involved with the procedure, and particularly what's involved after the operation. They should particularly pay attention to their home environment, making sure that their house is safe when they return, paying particular attention to stairs, bathrooms, and sleeping arrangements. They should also be in as good general health as possible under the circumstances, with good nutrition, smoking cessation, and general fitness being high on their priority list.
I thought about safety. Primary concern was, could I navigate around my home properly without injuring myself? So I removed scatter rugs, any tables that could have been in the way. I wanted to make sure that I was able to get to the kitchen, the bath, those sorts of things prior to the actual surgery.
There are a number of resources available for patients to prepare for surgery and to assist them after the surgical procedure. One of the ones that I particularly like is the OrthoConnect program run by the Canadian Orthopedic Foundation, which allows patients who are preparing for surgery to contact patients who have had that operation and find out from them what's involved in terms of preoperative preparation and postoperative recovery. It's very useful for patients who are concerned about the operation or have some anxiety about what's going to happen to them after the procedure. There are also resources available in the community run by hospitals which help patients prepare for their operation and assist them in their postoperative recovery.